Hey guys, welcome so much to Hopewell Counseling Farm, our YouTube channel. You can subscribe if you haven't, and it's going to be quite exciting. This month of May is Mental Health Awareness Month, and we are going to be talking about mental health in just the basics. What are the basics in mental health? What should you know on in general, so that you can be able to at least identify if you're having a mental health issue or if you're having a mental health illness. You can be able to pick up some things that might be beneficial for you. So my name is Sarah Muindi, and I'm a licensed counseling psychologist. I'm also the founder of Hopewell Counseling. So my host today, her name is Daniela Nashipai. I know it's weird. We're introducing the host and I'm the interviewee. You don't worry, follow us. All right. So my host today is Daniela Nashipai. She's a psychologist, and we're going to be having a conversation about mental health. And I hope that it's going to be of value to you, and that it's going to be something that you will share with your friends and tell people. So, Daniela, welcome, and thank you so much for choosing to agree to be the host for this live conversation on mental health awareness and being part of the mental health awareness campaign. So, I'm going to be handing over the microphone to you.
Thank you. Thank you so much, Sarah. Okay, as she has said, my name is Daniela. Hi to the viewers. I am a psychologist, and today I'm going to ask, we are going to talk about mental health, and I'm going to ask Sarah about how mental health is, what mental health is, what are we supposed to do with our mental health, how are we supposed to do once we have a mental health problem. And so we are going to go one on one. Like, I'm going to ask her, like, what is this mental health? People keep saying mental health, mental health. What is this mental health?
Okay.
Yes. Okay.
Mental health, only that in your mind. In Kiswahili, we normally call it afya ya akili.
Yes.
Mental health is when there is a balance between your social, your emotional, your psychological, and your behavioral state. So when there's a balance in how you relate with your friends, there's a balance in how you relate with your family, in how you're thinking, in how you're feeling, and also how you're behaving, we say that you're mentally healthy. But when there's an imbalance, either in your social life, either in your how you're thinking, in your thoughts, in your thought process, in the emotions that you're experiencing, and in how you're behaving, then you start to say, okay, this person might be having a they're not mentally healthy. There's a problem, there's a concern, there's an issue. So that's what we can say. Basic, yani ile simple definition ya mental health. Ukiulizwa mental health ni nini, unasema tu balance. If you're asked what is mental health, you say
Yes.
balance.
Oh, initially before I started doing psychology, I used to know mental only means our brain. I didn't know mental is all about physical, behavioral. So at least today I know, and I know someone else outside there who thinks mental is all about the mind. It's not only the mind, but also the physical, our behaviors, our emotions. Yes.
It's not just
Okay.
it's not just the crazy person that people are seeing on the street, or in the village eating from the dustbin, just
Okay.
because everybody just sees that. When we talk about mental health, we're talking about those people. No, we're also talking about the person who's in an office somewhere,
Okay.
corporate office, with the chair that goes round like this and a very big table.
Okay.
So talking about mental health applies to everybody. Me, a psychologist, you, a psychologist, somebody who knows nothing about the mental health space, somebody who is works who could do desktop level CTIA, third tier level jobs, and somebody who works the manual job. All of us. Mental health applies to everybody across the street.
Okay. Okay. Then how about the mental problems that you're having right now? What are the causes? What causes these mental problems that you hear about? Depression, about schizophrenia. Like, what causes this mental? health problems?
Okay, so
Yeah.
it's that's a very interesting question. What causes mental health problems?
Yes.
There are several factors. One of them is normally an imbalance in chemicals in the brain. So the brain
Okay.
has some chemicals that help to communicate so that you can know when to raise your hand, when to sit down, when to smile, when to cry. When there's an imbalance in those chemicals, it
Okay.
does cause mental health illness. That's a
All right.
first thing. A
Okay.
second cause of mental health illness is the environment. Think outside of the environment. Like for example, if you've had people talking about toxic work environments, a
Sure.
place where the boss is always on your neck, asking you questions, not giving you room to breathe or even make decisions,
Okay.
questioning everything, criticizing everything. There's a external environment. The work environment is an example. It can
Okay.
cause mental health issues and problems. The home environment can cause mental health issues and problems. Like for example, if you have been raised up in a home where there's violence, there's abuse, there's emotional and financial and physical abuse, that home environment can lead to mental health problems. So there's the external environment, which is outside of the
Okay.
individual. There's also the internal environment, the belief system of the person, the value system a person has, the thoughts that they have about themselves, their thought patterns, their behavioral patterns, how we do things, how we say things, how we respond to people, how we respond to questions internally. So there's that also can cause mental health illnesses and mental health problems and concerns. And those are just the basic. Those are just, when we are saying in general, when we are saying we haven't gone deeper and deeper to evaluate, to question, those are the basic causes. There's the internal, there's the external factors, and there's the physical, the ones that are an imbalance in your brain, of the chemicals in your brain. Yeah.
Okay, Sarah, how about genetical? Like, is it inherited?
All right. So mental health illness is not necessarily inherited, but the predisposition is, you have a higher risk of having a mental health illness if your mom or your dad had a mental health illness. So let me
Okay.
give an example. If your mom or your dad had schizophrenia, you as their child might be at a higher risk of getting schizophrenia, or if they had depression, you might be at a higher risk of getting the illness. Though it's not guaranteed, just because this is a condition or an illness that your parents or somebody in your lineage had, that you're
Okay.
also going to, because like I said, there are other factors that usually contribute or cause mental health illnesses, issues, and concerns.
Okay.
Yeah.
And how am I supposed to know, like, how is somebody else, or how am I supposed to know that I'm having a mental health problem?
Okay. All right. So usually, and let's say this, Daniela, everybody
Yes.
has an internal gauge.
Okay.
There's usually a way you feel and you're like, something might be wrong with me, or something might be wrong here. There might be an issue here. There's usually that internal view people have. So you
Okay.
can know that there's something wrong. You don't know what it is. There's just something. Something is off. That's what people say. But
Okay.
how you is when you're having symptoms like, for example, you're not sleeping well, your sleep patterns, either you're sleeping too much, sleeping too little, you're having intermittent sleep. That's when you're sleeping 30 minutes, 1 hour, 2 hours, 1 hour. Again, repeat the cycle. So you're not really sleeping properly all until it's morning. And so that's another concern when it comes to mental illness.
Okay.
And usually what happens is that when you're having a mental health illness, hey Daniela, can you see me and hear me clearly?
Sorry.
Oh, I'm asking if you're here with me or you left me alone. Are you here with me?
Okay.
All right, okay, cool. So we were talking about symptoms. How do you know that you as a person are having a mental health issue or
Yes.
concern? And we said sleep patterns. You might be sleeping too much, might be sleeping too little. You might be having intermittent sleep where you're sleeping for a few hours, then you're awake, another few hours, and then you're awake again. So that's one of the interruptions, sleep patterns. Another interruption can be in mood patterns. So some people who used to be so happy or used to generally have they would have a good humor or a good sense of humor, or they suddenly become so sensitive, or they're so quick to get angry, to react emotionally, responses that you'd normally not see with them. Like I said, you remember I talked about balance when we were saying what is mental
Yeah.
health? It's that
Yes.
balance. So when you're having changes in your mood swings, extreme ones, it's not the normal ones of you've had a stressful day, you're feeling irritable, you've had feelings of sadness for a few days, or you are super duper happy, or you are super duper sad. So across the board, it applies. So those symptoms, mood changes, are another symptom you can look out for. When you're feeling like you are losing an interest in the things that you had an interest in before, like for
Yes.
example, if you had a passion maybe for painting, you don't want to paint anymore. Or for example, if you had such a huge passion for your job, you don't want to
Okay.
work anymore. You don't even want to show up at work. There's lack of concentration before you really, focus, but suddenly you're not focusing as much. You become emotionally sensitive. When somebody says a joke, you get so mad, and it was just a joke, and
Irritated.
so you
Yeah.
become emotionally sensitive when statements are made to you, and very quick in terms of your emotional response. Another thing that you can tell there's a problem is behavior change. When I say behavior change, I mean, like, for example, if you used to
Yes.
really interact with people, you are a social person, and then
Okay.
suddenly you don't want to interact with people, you are withdrawing. You
Mm-hmm.
would have, your phone would not stop ringing because people are calling you for forms left, right, and center. They just have something they want you to, and suddenly the calls are going unanswered, the messages are going
Mm-hmm.
unanswered. You're just, even on WhatsApp, they're not being read. So you're starting to withdraw when you are a socially engaging person. Then those
Yes.
are indicators something might be going on here. Some people
Yeah.
even close, especially teenagers and younger people, close themselves literally in their rooms. So if they have a
Mm-hmm.
bedroom, they close themselves in their bedroom. If they have a bed, they're not waking up. It's 11 or 12. They're not tired. They haven't done any extraneous work, but they're not waking
Mm-hmm.
up. So, like I said, sleep
Okay.
patterns, sleeping too much, sleeping too little, and the other kind of changes in behavior. Another interesting change in behavior is in alcohol and drug use.
Mm-hmm.
Usually, when someone is having a mental health concern, the
Okay.
use of drugs increases or begins for some people. Some people never used to use drugs, and then suddenly they begin to use drugs, or if they were using them, then they increase the use.
Okay.
Yeah.
So in short, you are trying to say if it
Mhm.
interferes with the way you're doing things or your way of living, it's more of a mental health problem.
There
Okay,
might be a
thank you for
mental
that.
health problem. If it's interfering with your
Okay.
ability to function the normal way,
Okay.
there might be a mental health problem. It's not guaranteed. That's why you have to talk to a professional. But there might be. There are indicators
Okay.
that there's a concern here, there's a problem here.
Okay.
Yeah.
So thank you for that. That was awesome. And how about when okay you are diagnosed, you have a mental health problem? Like, are there any cures for these problems?
Oh, okay. Now,
Yes.
there's treatment, yes, when you're having a mental health illness. There is
Okay.
two types of treatment in the mental health space. The first is medication. You can be given
Okay.
drugs. Like, for example, if you have been diagnosed to have depression, which is a mood disorder, you'll be given antidepressants so that they can
Okay.
be able to stabilize your moods. If you are feeling so sad, you start to come up a little bit. So
Okay.
there's medication, there's treatment, and there's therapy. in many instances, we encourage that somebody who is taking medication for mental health illness also talks to a
Yes.
professional, also goes for therapy, for counseling services, because it helps them to deal with the issues that are not in the physical body, all the other environmental factors and the internal
Okay.
factors, the ones that aren't it's not your the chemicals in the brain. There's the when you're being stressed and you can't deal with the stress, when you're feeling so mad, when you're feeling overwhelmed, those ones. Now that's why we encourage that somebody who is in need of mental health or has a mental health illness also goes for treatment, for therapy. Sometimes you can go
Okay.
for your own treatment. Some of the medication, like all medication, has side effects. So you are taking medication for mental health illness, suddenly your hands are shaking, they don't stop shaking. You are a small person, you didn't have a lot of weight on your body, you started taking the drugs, and oh my goodness, suddenly your body just explodes and you become so big. So, and those are some of the concerns you have to talk to a mental health counselor or a psychologist, psychotherapist. That's why you go and see a therapist, because there are some things that the medication will not handle. And also the therapist can recommend that you also go and start taking medication, because they'll link you to a psychiatrist. So because sometimes it's not the physical environment, it's the biological.
Okay.
Yeah.
And are there chances that the drugs do not work or psychotherapy do not work?
Oh yes, sometimes the drugs don't work because you're not taking them.
Mm-hmm.
Yes, sometimes it happens
Mm-hmm.
very commonly that when people have been given treat medication to take,
Okay.
sometimes with mental illness, adherence is not so good. So people, you take the medication, especially those first few weeks, you're like, these drugs, I have to take them every day. I don't like their taste. When I take them, I feel so tired. You don't like
Sure.
the side effects of the medication. So you're like, let me just skip tomorrow, or let me skip this dose. So sometimes when you don't take the medication the way you have been prescribed for by your psychiatrist, it will not
Mm-hmm.
help. That's one of the instances. The second
Mm-hmm.
instances is that we usually want to have the medicine. We want to take like Panadol or like Maramoja. When you take the medication, you want instant results. You want, I just took the medicine, I was feeling sad, now I'm so happy, everybody let's go
Happy.
for a party.
Okay.
So normally, what happens with psychiatric medication is that
Mm-hmm.
it takes some time before you can start feeling the medicine starts working. Usually around 2 weeks. So you need to be consistent and stick with it. So sometimes you can take medicine, it doesn't help. Sometimes you can
Mm-hmm.
go for therapy, it doesn't help. How many people do we know who have gone for rehabilitation for drug
Mm-hmm.
addiction and they're still not?
So many, so
They're
many.
still abusing the same drugs, they're still going back for rehab, still they
Yeah.
haven't they have their lives haven't changed, the behavior or addiction hasn't stopped. So sometimes
Yes.
treatment doesn't work. Also sometimes it might be because you're not a right fit, you and the therapist or the psychiatrist. And with the psychiatrist, you really have to journey pamoja, you have to journey
Mm-hmm.
together, so that
Mm-hmm.
they can find the right medication for you, because sometimes the side effects can overwhelm you until it can't work. So when they give you the right combination, then you're able to function productively. But like I
Okay.
said, sometimes therapy doesn't work. You might not be a right fit to this therapist. You might need
Mm-hmm.
to see a different therapist. These drugs may not work for you the way they work for somebody else. You might need a different combination. So yes,
Okay.
sometimes it doesn't work. You are given meds, you don't take, you skip.
Mm-hmm.
Of course they won't work.
Sure.
Yeah.
Okay.
Yeah.
Oh, and so like if it doesn't work, if I'm not getting the support I wanted, like what am I supposed to do if I'm not getting the
So,
support?
okay. Like for
Okay, as in
example,
if the support does not help, how am I
okay,
supposed to
come
do?
again. I didn't hear the question very clearly.
Okay, I said like
Mm-hmm.
if the support I'm being given, like the psychotherapy support the medication support does not help, like what am I supposed to do?
All right. So if you are receiving treatment and it's not helping, it's not having the desired result, two
Yes.
things. One, you need to stick with it. If you are taking medication, like I said, if you're on drugs, it takes around 2 weeks for them to start having effect. So you need to be
Okay.
patient, and you also need to be consistent in the taking of your medication. So if the
Okay.
drugs are not working, stick with it for some time until you can see we have to at least move past the 2 week mark, at least.
Okay.
And then now we
Mm-hmm.
can review and say, okay, so the medication has started to help. Number
Mm-hmm.
two, if it's therapy and it's not helping you, you need
Okay.
to find, you may be the wrong fit with your therapist. So you go to
Mm-hmm.
therapy, they start talking, and you have already zoned off. Or let me give you another example. Sometimes the
Okay.
court mandates that a juvenile, a child goes for therapy. So they go to the therapist and they're just there. The therapist is
Mm-hmm.
talking in
Mm-hmm.
through this ear, out through this other ear. So
Mm-hmm.
you need to have to find the right fit if it's a therapist that you're seeing and you feel like
Okay.
the treatment is not helping. This is the
Okay.
other thing that helps, having a support system, having people around you who you can talk to, who will listen to you,
Mm-hmm.
who will understand you, who will support you. Because sometimes
Okay.
what you need is encouragement. And other times we go for therapy when we are not ready. We're like, now what do I
Mm-hmm.
do? Okay, let me just go and see a therapist. But we are not ready
Okay.
to do the work.
Mm-hmm.
So we also have a responsibility to be ready to do the work when we are going for the sessions. That way, it's helpful and it gives us a chance in receiving the kind of treatment and care that we are looking for. And it helps us
Okay.
so that the treatment works. So it may not be a
Okay.
right fit. You also need a support system so that you can be. Sometimes it's the support system that keeps you consistent
Mm-hmm.
because they will ask, Daniela, did you go for therapy today? How was it? You'll
Mm-hmm.
say, I didn't have money, so I never went. Okay, let me pay for you. Support system.
Mm-hmm. Okay.
Yeah.
Oh, that's awesome. That's great. So, mental health actually it's a wide topic and it has
Mm,
endless questions. So for today, I think those are the questions that I needed us to discuss with you, and I think I'm contented. And somebody out here who had similar questions, I think you've been helped. You've been somehow helped, and I think Sarah is available. Sarah is available. You can place a comment down there if you need help, if you need any kind of assistance. She is available. So thank you so much, Sarah, for the session. Thank you so much.
wow. Thank you. Thank you, Daniela, for making the time. And this is what I'm going to say. Yes, I'm available. You can reach out to me, send me a message, send us a DM on the platform that you'll be watching this video from, and we will be able to journey together and we will be able to help you. I want to thank you, Daniela, also for making the time to have this conversation with me. And of course, we will continue. We will do a lot more so that we can add as much value as we can to the young
Sure.
people, old people, all the people that are in need of mental health care services, which is probably everybody on this planet.
Sure,
Sometimes I normally
everyone.
say, Daniela, that I think every human being at some point in their life should go for
Mhm.
therapy. Yes.
Yes, very
Yes,
true.
and thank you
Yeah.
guys for joining us. Thank you for watching this video and
Hmm.
like it, subscribe to our YouTube channel, and share about this with a friend. We shall be seeing you guys in our next video.
Sure. Bye, guys.
Bye.